Why should we decriminalize assisted suicide? There are multiple arguments to consider when arguing in favor of the decriminalization of assisted suicide. The first argument is that authorizing this practice offers salvation and relief to the person who is terminally ill and their family. Indeed, the patient would be ending their sufferings, whether physical or psychological, while protecting their right to have a dignified end of life. Patients should be able to enjoy the last moments as much as possible and die without any pain in a safe environment. On the other hand, the support of family and friends has been a very important part of the process in order to enable the patient to have and give closure. The family will be happy to know that their loved one is making a decision that will make them feel supported and in peace, rather than living a painful and unfulfilling life. Furthermore, there is a financial burden upon the families because they are trying to treat in vain an irreversible terminal illness. Rather than paying for hospital care and expensive treatments that do not work, the funds can be used instead to give the patient nice experiences for their final moments of life. The second argument in favor of decriminalization of assisted suicide is that, as seen above, suicide rate is increasing, especially within the disabled community. It is important to understand that people who want to die will eventually often act on it. By decriminalizing assisted suicide, we would be providing those people a safe and dignifying alternative. However, we should not endorse any suicidal behavior and impulsive thoughts. The option of assisted suicide has to come into play only after a thorough analysis of the patient's behavior and chances of getting better. Moreover, as demonstrated by the increasing suicide rate, criminalization of suicide or assisting suicide is very difficult to enforce. Indeed, it is challenging to determine the exact circumstances and people's involvement of a suicide, especially those committed at home. Investigations are often conducted and are often a dead end, resulting in a waste of resources that the government is already lacking. Decriminalization would be a way to resolve these types of issues faster. The third and fourth argument are more of an ethical and moral point of view. Is it moral, ethical, and most importantly proportional to consider someone a criminal only because they are supporting a loved one in their inevitable end-of-life process? Yes, there is harm to another person, but what if the harm is consensual? Beyond consent, the harm is committed to help and benefit another person. This is no criminal behavior. On the other hand, it is admitted that suicide has wide implications and should be taken extremely seriously. This is why we argue that, even with its decriminalization, assisted suicide should be meticulously regulated and there should be a high threshold to satisfy to be eligible for this process. Finally, we have to take into consideration the wider meaning of criminalization and what its scope should be. There are two main theories regarding when the state can and should interfere in people's autonomy and freedoms. The first one is paternalism, that provides that the state should interfere to protect people from themselves and their harmful behavior. Paternalism is opposed to the idea of decriminalizing assisted suicide because that would be harm to oneself. However, we believe that paternalism is too dogmatic in its approach and should instead be more pragmatic in its thinking to consider each individual's specific circumstances. In this sense, we are arguing that the liberal approach is best to take for this situation. The latter provides that an action can be a crime only where there is harm to others. Eric Luna's interpretation of the harm principle provides that prevention of harm to others is the sole justification for state interference with personal liberty. Yet, assisting suicide might be seen as committing harm to others, but in reality, it is only about offering relief. It is very important to note that the harm principle is not and should not be based on moral, as highlighted by Jonathan Herring. Helping someone die could be morally reprehensible, but in practice, it does not result in harmful behavior and therefore should not be a crime in UK law.